Hi everyone, thank you so much for joining and welcome to our Klick webinar that we were hosting today. So we've got a great webinar and a great team that will be presenting it. If I go to the next slide. So my name is Jamie Campbell. I head up commercial partnerships at Avagen. And if you didn't know, Avagen are a digital health platform company. We work with healthcare providers such as Chelsea and Westminster. We work with pharmaceutical companies, and also we work with academia as well. And I'm joined by our partners from Chelsea and Westminster. So over to you, Sarah, to introduce yourself.
Hi, I'm Sarah Day. I'm one of the consultants at Cobler Clinic and John Hunter Clinic, and have been the clinical lead for the Klick service since it launched several years ago.
Hi, I'm Becky. I am an advanced nurse practitioner. I work at 2 of the Chelsea sites at Cobler and at the West Middlesex Hospital, and I've been involved with Klick since it launched as well.
Hi, good morning. I'm Kimberly. I'm one of the consultants in HIV and sexual health. So I also work in Cobler and in John Hunter, and I lead for sexual and reproductive health across the directorate.
So at Avagen, we build 2 different types of solutions. So one that empowers patients, so enables patients to better self-manage their health. So think of things like disease education, think of things like symptom tracking, think of things like communication with their doctor. And then also we've got solutions that improve the efficiency of outpatient management. And that's what we're going to be talking about today with Klick. Our product or our platform that we use is called Health Machine, and it's the same platform that it is used to launch all of these different bespoke virtual outpatient pathways. So Health Machine and our platform, it's a common set of building blocks that we use to launch all of our different solutions. So it contains security by design, a scalable infrastructure, an engaging UI, a tailored education module, this built-in behavior change framework in order to drive engagement, and as well as a clinical dashboard. And it's all built on the same regulatory ISO certified platform, which is called Health Machine. We've done this across multiple different disease areas, so maternal health, cardiovascular, infectious diseases, psychiatry, and more recently we've got into oncology and gastro as well. And we go through the same process for all of these different products. So discovery and design, where we work with you to look at what are the pain points to resolve, what's the journey, and then we design it. So we create a prototype, we then configure it on the platform, we deploy and validate it, and then we maintain it as well. So any bug fixes, any software updates is all managed by the Avagen partner success team.
So the Klick product is essentially a HIV outpatient pathway, which was initially introduced at Chelsea and Westminster into our Cobler clinic, which is my own clinic. It is a pathway that's supported by 2 pieces of digital tech. One is a patient app to help the individual navigate the service, and the other is a clinician-facing portal called Health Machine, which we use to communicate with the patient through the app. So we'll come on to sort of the registration rates and utilisation rates later, but essentially we started off as a pilot in Cobler in 100 patients in 2018. And then in 2020, we launched a more enhanced product of the Klick pathway at Cobler. And then in 2021, we launched at Dean Street and launched at another 2 clinics after that. It is an additional supplementary pathway. It was not replacing the existing mainstream pathway, so people could still access their care as they have always done. So essentially the only way that patients could really book appointments with our service was through calling up a call centre or turning up face-to-face to book. Difficulties cancelling or rescheduling appointments because had to go through the call centre. And obviously it's only open sort of Monday to Friday, the opening hours. In terms of the model for care delivery, it was very consultant heavy in delivery, with often quite long waiting times, up to about 6 months. We had an ageing cohort, an increase in number of people accessing the service with more polypharmacy, more complex comorbidities, placing more pressure on the service. And we also had very limited use of the MDT at the time, particularly junior nurses, sort of band 6 nurses, who weren't really utilised and didn't really have a very good training and development pathway at the time. And we needed to upskill that group. In terms of clinician inefficiencies, as you know, there's annual monitoring requirements set by BEVA, which we're expected to adhere to. To try and obtain all of these for each review of a patient, you had to trawl through a number of IT systems. It was quite burdensome in terms of admin time and prep and running of the clinic. And actually, when we've audited it against the BEVA national audits, I think there's been 2 monitoring audits. Pretty much all of them were suboptimal, both locally and nationally. And the last thing was around our ability to communicate securely and discreetly with our patient cohort. There was a whole mixture of ways of delivering results. Some would email, some would call the nurse's results line, but predominantly it was a no news is good news policy. And unfortunately, on some of those occasions, there was a worrying trend of datixes where we were missing abnormal results and not acting on them in a timely fashion.
It's very discreet, so it's called Klick. There's nothing on there that says HIV on it. And the patient sets a PIN number, which means that there's nothing about what it's about until that PIN number has been put in. So if someone picks up their phone, no one can see what Klick is about. Once they get into the app, you can see they can book, reschedule, cancel appointments, and they also get reminders of those appointments via the app. They can view routine blood results, and then when people have an appointment, we ask them to complete a pre-visit questionnaire to give us some idea of what they want to discuss and what the issues are for them, and they complete that in the app too. They can also order repeat prescriptions, and since the introduction of injectables, all our injectable appointments are managed via Klick. It also is a place where we can communicate with patients, so we can, as individual clinicians, send them push notifications, or as a clinic, if we need to send mass communication, we can do it via the app.
So this is just how things may look from a clinician point of view on Health Machine. So when you log into your clinic for the day, you will have a list of your patients, and then you can check them in, and then you can go in and view their consultation with all the pre-filled areas. But so as Sarah had said, it's a really good sort of guide with a sort of pre-filled performer with aspects that you need to collect. There's an area called the pre-visit questionnaire, the PVQ, and they're sent a reminder to do that the week before. So quite often people do use that and might pop in something, you know, I've had rash, I've had joint pain, or I'd like to talk about something. And as a clinician, I find that quite useful almost to sort of focus on the things that they may want to discuss during that time, or it might give you some time, if you prep before, to go and find a result from a different system or something like that, or something that needs chased. When we see them in clinic, all that is filled in, and then subsequently their results come into the system within a few days, and then we have the ability to go into that and to release their results to them, with also a rating, which we'll talk about. So they have correspondence of the numbers, but also in the context of does that need further action. And one of the bits I find very useful is there is an area where we can actually annotate and say, you know, you could say, nice to meet you last week, as discussed. We expected there to be a renal change or anything like that. And you can actually put in free text. And I think people find that very useful from a patient point of view as a sort of correspondence. And I think it's also really useful for us because quite often we don't like leaving phone messages. So it's a very sort of useful aspect of sort of communicating results or a plan of action with a patient in a sort of single consolidated area.
So this is the test result screens as the patients see them. So if you look on the screen on the left and the middle one, you can see there's kind of some results are green, some some are yellow. And so where it's green, it means the result is normal, no action required. With the yellows, it might be this is slightly abnormal. And again, as Kimberly says, you could put in there, for example, your cholesterol is abnormal, but as we discussed, this is a trend that we're expecting or whatever. And then sometimes there'll be a red rating, which is where we're very concerned. Please get in touch with the clinic immediately. So it enables us to communicate really clearly to the patient why we want to talk to them and any changes in their condition without them having to ring us find time to sort that out.
Having introduced the product, I'm trying to sort of showcase how we've tried to address the challenges that we initially faced. So we've definitely been able to put the patient in control of their healthcare and being able to navigate their health and prime certain consultations for things that they might want to discuss. They now have 24/7 online booking for appointments. They can choose between face-to-face or telephone appointments. They can order emergency medications, and they can schedule and get reminders and prompts around their injectable treatments if they're on that pathway. And for every step of the way, all the iterations that we have built into this product have been issued by the patients. So we've tried to listen to what the patients want and deliver, and I think that probably is a reason for why it's got relatively high utilization. In terms of appointment fertility, patients actually self-select as being stable when they come through the service, and this means that the junior nurses or the band 6 nurses who've now been mobilized to and upskilled to be able to manage the stable cohorts, that in turn releases capacity for the senior clinicians to spend more time on the complex patients or those who've got multiple needs. In terms of clinician benefits, there's definitely reduced admin time, and there is a limited amount of data trawling through the systems because everything now is in one single form that's really easy to eyeball, and you can then know all of the sort of the monitoring requirements in one at a glance view. And we've audited these against the BEVA national audit standards, and we'll show you those results shortly. So in terms of results, we now have the ability to track, users can track their results and see trends. And it is definitely better in terms of safer governance. We've not seen any further data about missed incidents. What's really nice about the platform is once you've issued a notification, you can see that the patient has visually seen it. So headlines really are in terms of engagement. This slide is a little bit outdated. We're probably closer to 6,000 registered patients now. With Kobler and Dean Street, it's around about 60% of our entire cohort have now registered on the app. And when you look at any utilization rates in any given month, well over 2,000 patients are engaging with the app, which is quite high considering most people don't really need to attend the service more than twice a year. In terms of evaluations by the patient, we generally do sort of surveys every 12 to 18 months, and this was the last ranking of the app at 4.2 out of 5, and some comments. 5 most frequent descriptors by the patients are stated there. We've definitely increased capacity, particularly because by upskilling the band 6 nurses, we've been able to add more clinics, and the appointment scheduling functionality of the app means that the DNA rates are significantly better than the mainstream service. As a result of the extra capacity added, the consultant wait times are now down to about 8 weeks to 3 months, and we've been able to increase the appointment times from 15 minutes to 30 minutes for every patient. So they're able to focus a bit more time on those with more complex needs. Probably won't spend too much time on the cost savings. This was a cost saving for Kobler Clinic alone, and that was due to natural wastage of consultant whole-time equivalents from retirement, which weren't replaced, and the band 6 nurse establishment has remained fairly static during that time. This shows the re-audit that we conducted on Klick pathway patients versus the old national audit findings in 2018, and we added a few other metrics on as well. But you can see that it's pretty much superior results for all but UPCR checks and GP registration rates. So we were really pleased with those outcomes. And these are predominantly band 6 nurse-led stable clinics that we audited. And we've done a number of different patient surveys. This is very busy, but the top two orange and green colours are really around the patient experience. I would say 3 things about that. They actually really like having a clinic-specific app, not something that's built into the NHS app. They like to have that personalisation of an app. And the big things that are the big draws for the patients are generally the online booking functionality and the ability to see their results and not have to recontact the service for them. We looked at some patient-related experience measures in blue. We were fortunate enough to be able to compare that to previous survey in 2017 and shown significantly better experience measures. And then the bottom section is really generic app questions, and anything above 80% on those app questions is deemed as excellent. So yeah, so in summary, really, we've sort of piloted a product, we've launched it, we've iterated it over the years, heavily in response to patient feedback. We've launched at 4 clinics now, including 10 Hammersmith Broadway and West Middlesex Hospital, and launching in Hertfordshire, 3 services in Hertfordshire across the next year. I think the model of care is quite adaptable and flexible to many other different areas of care, not just for HIV, but other long-term conditions. For example, it could be used for pre-exposure HIV prophylaxis, and we're also considering using it for the transgender service. And so actually, I think the Avgen team have been working in lots of other specialties in our own trust to try and establish a similar model of care for these different specialties.
What are the biggest pain points or challenges you're facing managing outpatients currently? And the biggest answer that we have there with the most votes is around inefficient administrative processes as well. And with second is long wait times for appointments and lack of clinical oversight. And Sarah and team, does that surprise you? And what would be your key tips for implementing this solution in order to solve those challenges?
We all said no, we're not surprised. So I think from the user end point of view, the instant accessibility of being able to book, being able to cancel, or being able to just press reschedule is really good, and to do that at any time of day or night, and not be restricted to waiting half an hour at the call centre, which is quite frequent. And I think then that leads to appointments not being cancelled or rescheduled, and therefore a very inefficient system with wasted appointments and DNAs. So I think from a user point of view, you gain a lot of efficiency on that point of view. From our point of view, I find it quite useful after doing our consultations. There is the ability for the information that you've inputted into the system to then press a button to generate a letter, and it pulls out all of that information into a pre-made letter that just needs sent. So that's really useful. And the way that it's formatted, we have entries at the end, plan or actions for the GP, and then that's all made into letters. You don't have to then leave a clinic and then dictate a letter separately, which then needs typed. It's all auto-made from the entries that you put in. So I find, in terms of administrative and operational processes, those are 2 useful things in my opinion.
The other thing I was going to add is that Sarah talked about, previously when we need to audit, we have to trawl through lots of different notes and whatever. When the patient consultation pro forma is completed, you click a button and that is put into a format that you copy into the patient's notes, and that format is standardized. So once you've got used to it, you know exactly where to look for when they last had a Hep B vaccine, or whether they're immune to Hep A, or what HRT they're on. You can see it all really easily there, so that's really helpful.
No, I think probably one of the biggest changes I found is in terms of not having to do patient letters. And I actually can't remember the last time I actually sent a letter to a patient, to be fair, in the last 6 months to a year, because I use the results piece to be able to deliver the results, but also do a bit of a follow-up. You know, we often sort of say on the day, you're going to have some bloods done. If it shows this, we'll do this. If it shows that, we'll do that. And actually being able to get the results and communicate to the patient without a letter, I find very helpful in my time management. And I think patients really love that personalisation. They love the fact that they get like a discrete message from their clinician rather than it going through snail mail.
And so the second question was, have you implemented any digital outpatient solution? If so, what has been your experience with them? And the two that we've got were yes, but they've had limited impact on our operation. So where people have tried it and it hasn't been that impactful, and then no, but we are considering implementing digital solutions in the future.
Do you know, I totted up a couple of weeks ago how many IT systems that I have to use to deliver my work in a week. And there were 20 systems. And I think that is the frustration that the clinicians have to deal with. And a lot of these systems are just not fit for purpose. Whereas I think this product has been born out of really properly researching the challenges that face a very large outpatient service. And I'm sure some of those challenges are reflected in other clinical settings as well. And research amongst the patients and research amongst the clinicians, and building something that benefits both. And I think that's why I think the utilisation rates are quite high for patients, because you're delivering something for them, and the utilisation rates for the clinicians is also high because you're delivering stuff for them. So I think if you get benefits to both patient and clinician, it's a win-win scenario. And the other thing that I would say is that you probably need to have somebody who's delivering that the project that you're planning, who's going to be there for a long time, or not for a long time, but like has got consultant input, or people who are going to be in the service for a long time, and it's not set up by, I don't know, management, or who may change, and you know, with staff turnover rates who are not there a year down the line, and therefore the product has that momentum and make sure it delivers against the objectives that you want out of it. So yeah, I'm not surprised there's a lot of stuff out there which isn't offering utility, and it can be quite challenging in introducing it. But I think we're going to go through some pointers as to how to do that, to how to implement an effective solution later.
Can I add something as well? When we talked about how effective it is, or the impact it's had, Klick has totally changed the nursing pathway. So for nurses previously, they were clinic-based, and then there were a couple of advanced nurse practitioners like myself, and there was no clear way of how these clinic-based nurses were going to be able to develop to get to the point that they could be an advanced nurse practitioner themselves. And Klick has totally changed that. So now the Band 6 nurses are independently supervised, but independently managing a cohort of patients. They're learning the skills to have consultations. And so now they are empowered, so they are motivated, they're likely to stay, they can see a development pathway. And also it has then freed up time for other clinicians as well. So in that sense, I would say impact-wise, it's had a huge impact both on the nursing team, but also on the clinicians. It's not just an IT system, it's changed the way we've been working really.
We have actually a couple of questions from the audience, so I'll jump over now. So we have one from Lucy, which is saying, how useful is the PVQ to both the HCP and the patient? How long are the appointment times for a patient, or does this depend upon the pre-visit questionnaire? So how useful is the PVQ to both the HCP and the patient? We could answer that question first.
I think it's really, so I think as a patient, and I'm sure we've all been patients, I think it's really useful for them to sort of focus. I mean, we have so many things within HIV. When someone comes to an appointment, we could discuss smears, we could discuss sexual health, we could discuss pregnancy, we could discuss testing children, we could discuss your viral load and actual drugs that you're on, we could discuss sexual health screening, discuss your Hep B. I mean, if you did everything, it takes a long time. So sometimes we do need to focus on particular aspects, particularly if they're important for either health or safety of the patient, but also the patient's needs or priorities. So I think the PVQ is really useful because we could ask 10, 20 questions, and then just in the last minute of their consultation, they go, well, I want to talk about this. So I think it's really good because we start with what they want to talk about first. And I think sometimes there's a lot going on for people, and I always say to people or relatives, you know, write down the questions before you go to the appointment. So I think it empowers them and it helps them sort of focus and also think about using their appointment in the most optimal way, but also like as a reminder. And I like that as a clinician because I know that I'm starting the consultation focusing on what's most important to them. And as I said, sometimes you may have to go and find something from a different system, or a result isn't back. You may not have met the person. They're like, I'm waiting for this result. It was ordered by blah, blah, blah. So you can go and find that from another system, or if something's outstanding, or if you need to check something. So it saves doing it within the consultation. Appointment times are usually half an hour, so it doesn't differentiate on the PVQ. It's preset.
I would say just the 3 points for the PVQ, which is why they've been it was introduced, is one, so that patients can choose whether they want a telephone or a face-to-face appointment, and then that indicates to the clinician on the day whether they're expected to call up or go to the waiting room, for example, and patients can change that up until sort of 24 hours before they come. The second thing is what Kim was saying, is there anything specific the patient wants to get out of it? The third thing is to capture all of the annual review requirements without having to completely just ask questions throughout the consultation. So you can capture all of the sort of annual review requirements and then tailor the consultation to what the patient wants to talk about. And that's quite effective. And actually, I think if you audit the Klick patients rather than the patients who don't use Klick and use the mainstream services, the documentation is pretty good for Klick because it just captures it, partly from the patient completing it and partly because it's built into the medical pro forma on there.
The next question was, how easy would this be to integrate into lab IT systems, and also how easy is it to change the format content once live?
Yeah, no, the way that we work for integration at Churl West is we work with the data warehouse team to be able to pull the results into the app. It's been pretty seamless, I've got to say, in terms of that integration piece. Yeah, I mean, I can't vouch for other services, but in terms of the Northwest London patch that we're working with, they're all pretty much on Cerner, so it should be possible for sort of Northwest London clinics to be able to work with Avgen. But I think just asking Avgen, if you wanted to consider using it, how they could integrate, they're very, very flexible. What was the second question, sorry?
How much does it change? How much can you change once you've gone live?
Oh, I think it's because it's just not an off-the-shelf product. I think it is something that I'm sure Avgen will work in terms of the flexibilities within your service. So we've gone live in 4 clinics now, and probably another 3 this year. They all work in completely different ways. So if you can imagine, Dean Street, it's a very young cohort. And Cobler, for example, it's a much older cohort with more complexity, and the staffing model is different, the appointment booking system's different, but the model is adaptable to however you need it to be. And generally what we've done is provide a sort of a specification for each service, and the service will go through that and say what they want or they don't want. Some people don't want the emergency prescription function, some people don't want the injectables pathways, but we develop it in conjunction with the clinic going live, and then it gets built.
And we're adapting it as we go along. We've added things, taken things out, both to medical screeners, to questionnaires. We're just updating some of the way that the results will appear to patients. So, and that's something that we're able to do regularly with Avgen. They're very open to change and monitoring it.
Yeah, echoing those points, we try to be very sort of customizable with the changes and the clinical pathway, both in the upfront and then the ongoing changes, because I think that's probably the biggest difficulty that people have with EHR systems or other systems, is the lack of flexibility, and they're very rigid, and actually the way that people work and the way that you want things to work does change over time. So the solutions should reflect that. If I go on to the next question from Katie, I'd be interested to know how this works with your clinical system. If PVQ consultations are on the platform, how does this link with the EPR?
So basically, You complete all your session by the health machine system. Then you click one button and it creates a Word document. You highlight that, copy, paste straight into your EPR system, and the notes are there. And as I said, because it copies that, creates that document, it's the same for every patient. So you learn exactly where on that page to look. And it's really clear. It's really nice. The appearance of those documents is actually really nice.
I would say, although that's a cut and paste, which is probably sounds like a governance issue, we did, because we've had Cerner now as our main hospital system since 2019. We have explored integration so that you can potentially export straight from Health Machine into Cerner, but actually the outcome doesn't look as good. And I don't think we've had any transcribing errors in the last 3 or 4 years. So we've actually continued with the cut and paste at the moment, just because it appears better and it's quicker. So I think it's possible that you can speak to your current infrastructure in whatever unit you're in to see if that integration of those document transfers can be enabled.
Next question was, can you explain more on the processing of accessing the emergency medication? What's the process? Is the treatment picked up from a clinic or hospital pharmacy, and can it be accessed from local pharmacies? And can they pick it up on weekends as well, or do they need to go through a HCP to pick up the medication?
So the emergency prescription it's accessed within either home delivery, if that's set up for the patient, or the patient comes into the clinic, the respective clinic, to pick it up. And the opening times may vary according to what that pharmacies, what the hospital pharmacy or community pharmacy's opening hours are. The way it works is they just select what they want in terms of medication and provide some contact details if there's any problems. That populates into an inbox for the admin team, who put it onto our like clinic templates in the main clinic, and we have someone who's assigned for doing emergency prescriptions every day anyway. So that has sort of streamlined the process a little bit more. So they now don't need to call up different numbers, the call center, come through to pharmacy. They can just request it on the app, and they can access that medication within 2 working days. If they are literally totally running out, we would say, or you've got less than 2 days, we advise them to come to clinic and do what they did before we had Klick. There was a lot of concern that would be really abused, but actually it hasn't. So we were going to put some rules in about, how many times you could use it and things like that, but we just haven't felt the need to do that. And to sort of answer one of the other questions about self-management, we did introduce the PVQ at the beginning to try and be able to use it as a triaging tool, to be able to identify who is stable and who is a little bit more complex. But we got rid of that because actually patients, they know. I think they just know. They've been with the service. Some of the patients have been with us for 30, 40 years, and they know who they need to see. And so we didn't feel that sort of triaging aspect of the PVQ was required, and we changed it since then.
I would also add to that as the nurses have become more experienced, more confident, what is stable? And I think that's a big question that many of us grapple with. But as they become more experienced and more confident, they're able to manage slightly less stable. And so, again, those lines are a bit more blurred.
A follow-up question. How does integration work with appointment bookings between app and the EPR? Do you have to manually upload clinics to the app and block them in your EPR, and then manually populate on your EPR, or is there a link between the two?
There currently isn't a direct integration with the patient appointment booking system, largely because Cerner system that we use doesn't allow it. So we have a system whereby we have just Klick clinics, and patients can book into the Klick clinic via the app, or we have the mainstream clinics where they can book into it through the call center. And we don't actually populate the clinics until literally the morning of the Klick clinic. So because we give patients enough time to be able to cancel or reschedule appointments. So usually what happens is on the morning of a clinic, the admin team will populate our Cerner, sort of our single source of truth in terms of our patient appointment record. They will populate the Klick clinic on the day of the clinic. And although that's not ideal, I don't think we're going to find, probably in my lifetime, a way of integrating with Cerner using a patient app to be able to have direct appointment bookings.
I have a question as well. So how do you go about onboarding patients and clinicians onto Klick?
I mean, we've at Kobler, for example, which was where we launched, I think we might have had a couple of very small SMS campaigns for people who we knew were going to be coming up to needing their review. But then we didn't really plug it. It's been very much word of mouth. It's been very much they come in when they have their consultation and we talk about how they're going to get the results. We onboard them to the app at that point, talk to them about what's going to happen, and then they can then book their future appointment through the app. So it's very much clinician-led, nurse-led, and signs in waiting rooms and things like that. Dean Street were quite different. They did a massive campaign, which is what they like to do. But that was really successful. I mean, probably, I don't know, 2/3 of the cohort had signed up within 6 months of those two campaigns. And it's very popular. It's very popular over there. I'm not sure what you're doing at West Mid.
So at West Mid, we're doing a similar system where we're doing a small SMS to people that we know are coming up. They're due an appointment, they haven't got one booked. But also in clinic, the real kind of shoe-in is to talk about how do you want to get your results, how do you want to do that, download this app, and that's really, really popular way. And then once they've got the app, they start seeing, exploring it, seeing what they can do, book appointments. So yeah, it's been very clinician-led, but also yeah, I think word of mouth among the patient groups as well has been, as patients talk to each other, know each other, they've said, oh, have you got this? And that's helped as well.
And how about onboarding clinicians? How about convincing your colleagues of the utility and the benefit of using Klick? Or has that been somewhat just proved by the utility of the solution? Or did you have much resistance against it internally?
I think there's always a little bit of nervousness when clinicians feel that nurses might come and do lots of stuff, but I think the fact that the nurses they've been very successfully trained, they've completed competency frameworks, they're supervised by a consultant. So before each clinic, the nurses meet with the supervising consultant, talk through the patients, check that everyone's in agreement about the management plan. Once the nurses started, the nurses were very keen to get involved. So it started initially with the nurses, and they were very keen to get involved and very keen to begin. So that wasn't difficult. I'll hand over to the doctors about the doctor's side.
The doctors, yeah. I mean, I think it depends on whether, in terms of the results, how they deliver their results. Most consultants and senior clinicians have their own methods. So some clinicians use it, some clinicians don't use it. At Kobler Clinic, at Dean Street Clinic, I think it's the default for delivery of results. I think prior to our Cerner system coming on board, there was a service called Option E, which was a remote service. And when we moved over to Cerner, something had to be replicated. And so there was a significant onboarding of patients and significant usage by the clinicians in releasing those results using the Klick app. I think it depends on whether you, as a clinician, whether you have your own clinic on Klick or not, or whether you're only booked through the mainstream services. So Kim does all of your clinics on Klick, and it's probably best suited for people who maybe do 2 or 3 clinics a week, so that some can be accessed by the mainstream pathway and some can be accessed through the online booking. But you have to remember there are some patients who really will not download an app. They do not want to have anything on their phone, and you need to make sure that they can access the clinics readily as well.
Yeah, obviously we've all got patients who we may have known for a long time. Sometimes it's easier to introduce change when change is already happening. So for me, my days were changing. So my whole clinic was changing from a Thursday to a Tuesday. So it made sense when I changed days and I changed my clinic resource that actually that was my clinic then became a Klick clinic. So for me it was at a point of change. So I think that's quite a natural sort of progression. again, people have different sort of familiarity and happiness with embracing digital solutions, don't they? And Sarah and I are probably quite digital. so she asked me if I wanted to do mine. So I was very happy. For me, I find lots of advantages. As I said, like when Becky's saying about results and texting patients and things like that, it's just, you know, I find it very frustrating when you've got to convey a result or something important to someone and you constantly just miss call, and you don't leave a message. And then you might not work the next day, and then the person's then getting agitated. I've got all these missed calls, but there's no message, and then the worry. So I think in terms of benefits for patients, you know, it takes an awful lot of sometimes anxieties and things like that away, because there is this direct way of communicating, which can sometimes be quite useful. But I think as someone who embraced it like about a year ago, I think it's just seeing what the advantages are. There are lots of advantages, and then just understanding that you know how to use it properly. So I think we always just take on new things a lot of the time, and we don't really get fully trained. So I spent time with Sarah and with Carolyn, who worked here before, going through and actually understanding the system. I have the app, a test flight app on my phone, so I can actually show it to patients with no data in it, and actually say, and actually have like pretend dummy me and show them how things will look and help them to navigate. So I think, you know, that's the sort of way to do it, is to sort of, you know, show people the advantages and how it can, as you say, benefits patients, but how it can benefit clinicians as well. And then when you're onboarding patients, is to actually just take a little bit of time and do it there with them.
I think actually Shashank's question I've misinterpreted. So can you give more detail on enable patients to self-manage, how the solution helps patients to efficiently manage and improve their appointment adherence, not app adherence?
So I think for the appointments, for any of the appointments, they get reminders and they're able to visualize them. For the injectables, it's slightly different, because there's obviously quite strict windows within which you need to have your injection. And so we issue reminders for booked appointments. And then if there's not a repeat injectable appointment booked within 7 weeks from the previous injectable, they get a prompt to say, you need to book the appointment, you may need to go, you know, it might affect your injectable pathway if you don't. And so from the reminders and the prompts, that can help adherence. I think in terms of self-management, we've launching at the moment a content library, which has probably about 50 different resources on it, which are things that we generally encourage patients to do in clinic. It might be around bone health, it might be exercise therapies, it might be information about statins, about lipid lowering, dietetics, things like that. So the general things that we talk about in clinic, there's now a resource library within the app so patients can access it, and that's been inputted by all of the MDT. So that helps in terms of self-management. And then the other aspect is what we wanted to do, which we haven't yet done, is make the PVQ really smart. So if someone comes in and they identified they're a heavy smoker, they might be signposted to the smoking cessation services within the app or within the website. That aspect we've not worked on. It's something on the wish list, but I think that would be helpful in enabling self-management and self-education for the cohort.
So talking about appointment adherence, so currently I am working with Lupin Digital as a product manager. So we have an app and we have similar functionality for appointments, but the main issue is patients don't adhere to their appointments. Most of the time what happens is patient doesn't pick the call, or patient is not available at that time and wants to reschedule multiple times. So how do you tackle these issues? Because I think HIV is a very like prominent disease, so maybe the patients are more aware and patients do the appointments more rigorously or religiously, but it doesn't happen with other cases like ACS or HF.
I think if I understand what you're saying right, I think it's accessible at their fingertips. So if you have an appointment tomorrow for Klick, and then suddenly something different is going to happen and you can't come, you just get your phone and you just open the app and you just press reschedule, or you press cancel, and that appointment will then be released, and that appointment can be used by someone else. So I think the important thing is about sort of cancellation when we cancel an appointment, then it's also made available to someone else. You've got the refill rate, so it's a much more efficient system. The alternative to that would be you've got to go and phone a call centre, and now that might be 6 minutes, or if we're phoning the passport office, it could be like 4 hours. But you know, some people just don't have time to do that if they've just got like a half an hour lunch break. So I think we're making it very easy for people not to DNA. We're making it easy, and I think when we onboard people, we tell them, you know, you need to, is it 24 hours is the time that they need to cancel in. Mm-hmm. So they're aware of that. And actually saying to someone, it's okay if you cancel your appointment 2 days before, that's fine. That's not a problem. Just do it and it's opened, and then someone else might actually use that slot. So I think rather than having all the guilt about, oh, I'm not going to turn up and actually I'll just forget about it, forget it doesn't actually exist. People do actually cancel last minute. So if you looked at your list the week before, quite often the list in your day, there is actually change. So I think because it is so easy to cancel it, and then someone else can then often use that slot, I think it's accessible at your fingertips.
And the app also sends them prompts reminding them of their appointment as well, which then either prompts them to go, oh, I can't make it, or oh yes, I must go. So, and the option of doing a telephone appointment also, you know, you can change that right up to 24 hours before. So suddenly if you think, gosh, I can't go in, but I can do it on the phone, you can do that. We only offer phone consultations of that nature via Klick. So you can't. Yeah.
And I think sometimes people don't fill in the PVQ, so you don't know if they're coming in by face or phone. So what I tend to do, if they've not filled in their PVQ and they've not turned up, I phone them. And usually they always answer, because it is an option that they could have had phoned. Whereas I think when people DNA a usual clinic, I don't think everyone does actually phone them. So that's even more waste. So quite often they'll go, oh, I just forgot, or oh, I forgot to write down that I wanted phoned, or, you know, so.
And one thing that I did find out in the research before we launched this was actually some of the patients' frustrations were enforced cancellations. So they were basically clinics cancelling the appointments for the patients and sending out a separate appointment, which might not be appropriate. And that has two things. So sometimes they then don't DNA, they don't manage to cancel and reschedule with using the previous methodology before. But it also then puts them out of kilter with their medications, and they often then need an emergency script, for example, because their appointment has then been pushed too far into the future. And so having the rescheduling function and the ability to top up their meds if they're going to be running short, I think helps general self-management for the patient in navigating care.
It sounds very silly, but quite often if you do have an appointment in some places and you phone up and say, I can't make that appointment, that's fine, we'll cancel it, we'll send you a new one. And then you're like, no, I don't want you to send me a new one because that might not work either. I want to agree a date that suits us both now. And quite often in some services they won't do that. So you're constantly in this cycle of, you know, trying to rebook another one, cancelling it, and you know, it's just a bit crazy.